Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning. So it's a beautiful... Did you see the sun go down the other night?
Which night?
The sun, it was on...
The night you and I went out.
Yeah. It was either, I think it was Thursday, maybe.
Look, when they just sent me a sunrise.
Right, that's it. I mean,
this
that's
is
the
from
sunrise.
this morning. This is the sunrise
well, you
from
should
this
have
morning.
seen the sunset.
It's so beautiful. Look at that.
The sunset, though,
Wendy,
was amazing.
For the inspirational sunrise. Tell me about the sunset, Anita.
Well, that was like a huge orange globe. It was covered everywhere, even on television last night. National television, they were showing.
Really?
It was spectacular. Something to do with this and that, and the way that the comets are lending, whatever it is.
Yeah.
So we're here this morning.
Yeah.
We're going to talk about the comets who are living at home with dialysis and who need your help.
Absolutely. So many people that, we spoke about my book on the kidneys.
We don't speak about it enough, as a matter of
protecting
fact.
your kidney. It's so interesting. I need to get a good marketer person to get that book out there.
Okay, I guess you're giving me a new job.
Yes, because, you hear so many people out there, and the only time you hear about people having kidney failure is when a celebrity out there, somebody that is known, and then they get brought to CNN or so-and-so, is having kidney failure, is going to undergo dialysis. But then we don't do, I guess the American Kidney, Association need to do more to bring awareness. As we discussed before, the reason that inspired me to write that book is that so many people die before dialysis. And then comes dialysis. And it's such a, like we said just before we went on there, it's such a depressing topic.
Well, because I had a friend who, he said, I can't go on 3 days a week. I have to go and do this. It's just too much for me. I just want to leave. I want to leave this world. So maybe you could talk about dialysis. First of all, you're very good at prevention. Let's try to keep your kidneys healthy.
Absolutely.
But then when it does happen, and your home visits are very important to those people because they come home after dialysis, they're exhausted.
Well, last year, we didn't have that many patients because we were not promoting home visit. And last year, we did have a patient for home visit that developed what we call chronic kidney failure. Chronic kidney failure is when your kidneys are decreasing in function very slowly over time. An acute kidney failure is when somebody gives you the wrong antibiotic at a very high dose for about 3 or 4 days. That's all it takes. And you can go into kidney failure. And it's what we call acute kidney failure because it just happens in a matter of a few days. People think that dialysis is permanent, it's for life, and not always. Most of the time, usually, it is for the rest of your life, unless you get a donor to give you kidneys, and then you stop. But sometimes we do dialysis for people that have an acute kidney failure. And the objective is to go in there and do what the kidney is supposed to be doing. Because remember, a dialysis machine is not your kidneys.
See, excuse
me,
I think I have to stop you. I want you to tell us what dialysis really is. We hear it, but tell me what it entails.
Well, the kidney, what it's supposed to do is get rid of all the waste material and also the excess amount of fluid in your body. And that fluid and waste material become urine. And then we go and we urinate it. Okay? The dialysis machine, well, when the kidney fails, you cannot urinate. A lot of people on kidney failure, you cannot ask them for a urine sample. They urinate so little. So,
excuse me, where does it go?
It stays inside your body, and you will die if you don't get dialyzed. If you keep all that waste material and the excess amount of fluid, what's going to happen? You're going to go into congestive heart failure. The liver is going to get loaded with fluid and it won't be able to function. And then you go into what we call multi-organ failure. Your heart will fail, your brain will fail, your liver will fail, and you'll die. and it's a horrible day. So the kidneys are so important, and that's why we should go ahead and try to protect them. Be very cautious, and every time you see your doctor, say, how are my kidney doing? How's my liver doing? So the kidneys are very important. So the machine, what it will do, there's two types of dialysis. There's hemodialysis, which is when you get hooked into the machine and you go to the hospital or you go to one of the dialysis centers to start treatment. And there is peritoneal dialysis. And peritoneal dialysis is when they go in your belly and they put a little fistula in there, which a fistula is taking one of your artery and one of your vein and make them connect. Because remember, you want to get the fluid that is going, the artery is trying to bring oxygen, and the vein is the one that is bringing all the waste material. By connecting them, then you put in more pressure on the vein so we can flush this thing out faster.
Never heard of this.
So that's
How
called...
do you spell that?
The peritoneal dialysis is PERITONEAL.
Peritoneal. Okay, that's
so peritoneal
good.
Is on the belly, and the hemodialysis, that's HAMODIALYSIS. That's hemodialysis. And hemodialysis is the one that we use most commonly today. I have very few patients that do peritoneal dialysis still. And they are at home, and sometimes those are some of the patients we have to go there and do home visit for them and to help them out. And once you are on dialysis, it's like a person becoming suddenly a diabetic. You have to change your diet. So a person on dialysis, they cannot eat, whether healthy or unhealthy. They cannot just go ahead and eat everything. You have to be careful with the amount of protein that you are eating, the amount of potassium going into your body. So all the electrolytes in your diet have to be closely monitored. So those patients get seen by the dietitian, either Courtney or Nicole, will work with those patients. And usually at the dialysis center, they will also have a dietitian to work with you and to help you out. And they cannot drink a lot of fluid now because, remember, dialysis is trying to get the excess amount of fluid out. And like you would say about your friend, it's a procedure that takes, on the chair, you're talking about 3 to 4 hours, 3 times a week. So one of my patients, he used to hold a job, and he just couldn't do it. But he, of course, automatically you will get Medicare, Medicaid, all the insurance will kick in because you're going to be dialyzed for the rest of your life, most likely. So my friend, what he did, he's a young guy, 37-year-old, and he opened his own business at home. He said, I just don't want to live from, a little pension. I still want to do something with my life. And he had been my patient for probably about 12 years now. And we just heard, and we started doing all the process, and that's a whole thing. That's a whole different topic.
A new kidney.
He just got on the list for a new kidney.
Oh,
he's going to get it.
Great.
We have to do bone density, echocardiogram. Oh, my God, we have been doing so many things. And they want to make sure that he's clear by the cardiologist that the kidney. Of course, if you use drug or anything illicit, then, they will take you off the list automatically. So we have to do all the drug testing and prove that he's very clean. And he have been working from home so that he can go and get dialyzed. And he take good care of himself. You always see him on the phone doing research. And when he come with a dietitian, he's always saying, well, I learned this, what you think? Even with supplement, the person on dialysis, you have to be cautious with supplements. Anything that go into your body, you have to be so cautious. So it's a very depressing topic, but it's a very important topic because,
my question is, why did you write the book on that? Of all that you could have written, you haven't written other books. That's the only book you really wrote so far. Why did you choose that? I mean, are you a specialist in this?
No, I did write another book.
I've never seen it.
Yeah, it was on first A for martial arts. You know, I'm a Taekwondo grandmaster.
I see. All right.
So I'm being a doctor, and I was the chairman of anti-doping. So I wrote a book on that, and I wrote a book also on the founder of Taekwondo. So I have a few books, but it has been more on martial arts. This is my first one on medicine. Yes.
Well, let's talk about
that.
I wrote the book? Why did you write that?
Because I was invited to the Pennsylvania Nurses Association. They were having their national meeting. I was the keynote speaker. And they wanted me to talk about kidneys. They were very interested in kidneys. And so I started looking at anemia due to chronic kidney disease. And as I'm doing my research, I say, oh my God, look, over 500,000 have stage 1. About a little bit more have stage 2. Stage 3, it dropped down to a quarter. And then goes half of that going to dialysis, which is just toward the end stage 4 and 5. So I say, wow, it's so many people up here. And why we had that big drop just before dialysis? So I started doing my research, and the research, I bump into the fact that most people die before they get to dialysis. They don't get to dialysis on time, and they die. So I say, oh, my God. I mean, I wasn't aware of that. How many people out there are aware of that? So I say, we have to teach people to protect their kidney so that the kidney can protect them.
Yeah, that's the name of the book. So, all right, what we're going to do, we're going to put your book in Boomer Times again.
Yeah, front page. Woo!
Right. and we have to do something about this. Yes, we're going to do that. I'm very thrilled.
Absolutely. It's awareness, and so many people, people come and they get checked by the doctor. Listen, forget about your insurance. It's not your insurance. Forget about whether I'm going to get paid or not. You have to get checked. If you are taking more than 2 medication, more than 2, you don't have to take 20. I have patients that take a lot of meds, plus the vitamin. It become over 20, close to 30 maybe, with all the vitamins and supplements. If you take 2 medication, get your blood checked at least every 3 to 6 months. It's a simple stick. Go in there, go to your doctor, say, just check my blood. Let me know how I'm doing. And that's called prevention. Because if you're having kidney disease, look how subtle stage 1 can be. Stage 1, when you do the blood test, your kidney can be completely normal on the blood test. But when you do the urine test, you might have a little bit of protein on the urine. When the moment we see protein in the urine at my centers, we get an ultrasound of the kidneys.
Oh.
So if I see that the kidney are shrinking and you already have a little bit of protein, that is considered stage 1 already. Whether the blood test demonstrate that or not is not relevant. So at that time, we start working with the patient. Are you drinking enough fluid? How many pills are you taking? Are those pills all being processed through the kidneys? Because there are pills you can take for anything, for blood pressure, for seizure, for atrial fibrillation, for diabetes. There are so many things you can take. Some of them get processed to the kidney. Some of them get processed to the guts. So if we are having a little bit of kidney failure and your kidney is asking for a break, maybe we should switch to something that get processed to the guts and not through the kidney. Give your kidney a break. They are asking you for one.
Smart.
But if you don't go to the doctor, you're not going to see the protein when you urinate in the toilet bowl. You're not going to see it.
So when you go to doctors and they all want a urine sample, that's what are they looking for?
We
that
are
and
looking
other
for
things?
How the kidney. We want to see how concentrated the urine is. So it's called the specific gravity, and that gives us an idea whether your urine is too diluted. Say now we're talking about pee. So if the urine is too diluted or too concentrated. If a person drink water in excess, you might dilute your urine too much. If the person does not drink enough, or the kidneys are not working to its optimum, your urine might be too concentrated, which means that you are retaining most of the fluid and only the waste material is coming out. So We also look at blood. You are not supposed to have blood in the urine. We look at protein. We look at sugar. You are not supposed to have sugar in the urine, with the exception of new diabetic medication that has just come out that make you urinate the sugar, so you are pulling out a lot of the sugar through the urine. Excellent drug. They help you lose weight, bring down your blood pressure, and instead of the kidney reabsorbing sugar, you trick the kidney and block those reabsorption, block those windows, so the sugar goes just straight out into the urine. So we look at sugar. If you're not taking one of those medications and we see sugar, then we ask whether you are a diabetic or you're eating excess amount of starches in your diet that is making you urinate the excess amount of sugar.
I think it's a good time for me to stop and to introduce you, because so many people say,
tell me who
it is, right? Dr. Andy Mencia. Of course, you hear him every Saturday morning on the Wonderful World of Wellness, and people have gotten well from listening to this show with him. I have to say, he has caused maybe it's a minor revolution here, but a good revolution. AGI Medical and Dental Centers, they're now located, they've been in Fort Lauderdale for many, many years, but now they're in Boynton Beach. If you want to go on a Saturday, you can go down there. He's rushing to go there as soon as he's finished with his show. For an appointment, you can, well, actually, an appointment would be 954-489-1345.
And we and dental, we're both open today.
Oh, wonderful. Dental
and home visits.
Medical.
And we are doing home visits today.
And home visits. So this is your lucky day, right? 954-489-1345. If you want to call Boynton Beach during the week, you can go there. They're located off Hagen Ranch Road. It's 561-270-6494. And you can get on their website, which is really easy, and that's agifl.com. That's Adult Geriatric Institute, Florida.com, but that's just what it stands for. But the actual letters to get on there is agifl.com. Well, I think this is an excellent topic, because the man that I told you about did just pass away. He was very frustrated, and he wanted a new kidney, but he waited for a year or two, because that's not easy either.
Well,
there are not a lot of extra kidneys, I gather.
Well, no, I think the government need to do better. You know, the responsibility is really fall on the government. And it's very unfortunate when you see patients, you see American traveling abroad to buy kidneys, going to other country to buy kidneys. And, you know, we have one of the best healthcare system in the world, you know. People come here because they respect us for what we do and how we do it. And when you're going to get a new kidney, they have to go through all the scrutiny of making sure that they are not giving you any disease, that they are giving you a kidney that is going to function for you. And people get, like your friend, get very frustrated. And it's we as Americans, we need to take a little bit more responsibility.
So where are they going to get the kidneys from? Why is it the government's? What can happen if you were running our chief
if I'm
the
advisor,
world, right?
the advisor for the United States government.
Okay.
I will likely have everybody in their driver license. Okay, have some kind of a code where as soon as you arrive into an emergency room, you know, God forbid I'm driving and I get killed in an accident. If I arrive in the emergency room, they pick up that driver license and say, you know, this person is willing to donate the kidney. So to get more people to do that. And we get a lot of people that is so much red tape that people go through. The donors now. People that want to donate, they go through so much red tape. Exactly.
Yeah, see? Richard has just brought us something in. It shows that he's an organ
donor. And so am I. So we all should be organ donors.
I don't have that on mine. I'm giving my body, not my organ.
People need to be, you know, that's the awareness we need to bring out there. You know, So if something happened, you can donate. You can donate all of your organs that can be used to save other people. To save other people's life.
So you're saying,
and very few of us are becoming organ donors.
That's interesting. All right. Well, that's a very good point. And so that's a little discussion maybe at the end of the article. I want to do an article this month on this. I think this is fabulous, Dr. Mencia. Especially, we're going to feature your book. We're going to put it on the front cover and of the April issue. We'll go ahead and do that this time. And then we're going to...
It's a great book,
Yes,
it's a great book because it takes you from the genesis, how the kidney are formed in your body, all the way to dialysis, and how to live with dialysis. That is, it does not have to be a very depressing situation, but that you need a team to be together working for you. That's why dialysis centers are getting more and more popular than hospital, because it's more personalized, the care.
All right, well, let's move a little further with that. So now I do have another friend whose husband is getting a kidney. He's been on dialysis for years, but somehow Jackson just called. They have one for him. My question is, what's his life's going to be like now with a new kidney? A special medication?
Special medication you have to take. You have to basically maintain the immune system on a standstill. So there's a lot of medication that you take so that you don't reject. Because remember, if I take my kidney and give it to you, or vice versa, the first thing the body is going to do is say, this tissue don't belong to me. And they're going to start rejecting the new kidney. So you have to take medication to keep the system down. And you see a lot of times the person that get a new kidney, they sort of blow up a little bit because of the prednisone or the steroid they have to take, and keeping the immune system down. But once the kidney take off and the body start sort of accepting, recognizing over time, then you start decreasing the other medication, but you never come off from them. Just try to decrease it to a minimum, because remember, the risk is that you might reject the kidney and they have to go back in there and take them out, because it can become a very horrible reaction.
And can someone can live with one kidney?
Yes, many people live with one kidney.
Yeah, so that's another thing. So
if you lose one kidney, let's say some people, they get into an accident or something, they end up losing a kidney. The other kidney, the way God made our body, the other kidney will take over 100%. So you function completely normal, but those people get told, you only have one kidney, so you better take care of it. We should take care of both of them, But
they can live with one kidney.
You can live a completely normal life with one kidney. You will have no problem.
So when someone's on dialysis, though, both of their kidneys are affected. Is that why they don't just get rid of one kidney?
Exactly. Because, dialysis is you have millions of filters inside the kidney. So when your kidneys are dialyzing your blood, the way God meant it to be, so when the kidneys are dialyzing your blood and you start taking the wrong medication, you start losing nephrons, which are those units that clean the blood. So if you lose 10%, you don't notice any. 10%, you notice a little bit of protein in the urine. Then it goes to 15, then it goes to 20. Then you lose half and half of each kidney. Now you are 50% down in your kidney function. Now you are in trouble. And then you go lower and lower and lower.
I don't usually hear people have kidney cancer.
Yes. Very uncommon, but yes, it can happen. Kidney cancer can happen. It's under my book.
It's in okay. Well, we're going to do that. Yeah. Well, this is a fascinating topic. I'm so glad that we did this on dialysis. You were certainly, it was a surprise this morning. I'm really pleased about it. And remember, home care is so important, especially if you are on dialysis. You need to be able to call Dr. Mencia's beautiful organization. They certainly will make sure that someone comes out to take care of you, because I would think if you live alone, I know that people pick you up for dialysis, they bring you home, and then you're home by yourself.
Right.
And you must be depleted, you must be...
They get very depressed a lot of times. So even, the type of medication that we use for depression, we have to be every medication that go in that person's body, we have to be so cautious from that point forward.
And see, you're in such a rare doctor, because so many doctors have no idea. See, they're told before you take this, ask your doctor. That's the very common. The doctor says, well, I don't know. I mean, you know that and yet you do know.
I had a patient that switched to me because she was having an infection that the doctor couldn't cure. And the doctor would say, take this antibiotic first thing in the morning. So guess what? She was getting dialyzed 3 times a week. So she would go take her antibiotic first thing in the morning, but 3 times a week, that drug was being pulled out by the dialysis machine. Wow. So I say, oh, your problem is easy to solve. Just do not take the antibiotic before you go to dialysis. And exactly, the day before, get up early in the morning so you can take the antibiotic. So by the time you go to dialysis the day before, because it's going to get whatever is left from the day before too. So you get up early in the morning, 4 o'clock in the morning, take your antibiotics. So by the next day you go to dialysis, it had been over 24 hours. The drug is killing the bacteria.
And we have to say goodbye to you. We have to have people come down to your commercial boulevard.
I want to stay.
I know you do. We want you to stay.
Hold you by the leg.
Right. But you have patients waiting. You can stay. 954-489-1345. They're open today. They have dental is there. And, of course, Dr. Mencia is there. This is rare. Most
I was so happy the other day. We have the podiatrist, we have the dermatologist, we have the dentist, we have the dietitian on a Saturday.
It's always your dream. It's always your dream. Thank you, Dr. Mencia. It's wonderful to have you here. Everybody, agifl.com or 954-489-1345. Thank you again for a wonderful, wonderful conversation.
You're welcome.
See you next week.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.